Hi, my name is Austin Ejebo. I'm a second year nursing student here at UFM, so I'm going to be demonstrating how to administer the injection medication at this minute. And the medication I have right now is dimethylhydrinate. So, and I have a patient who has been vomiting, so, and that's the reason why I need to administer this medication. So, first of all, I have to compare my mouth chart with Dr. Soda. So I have to check that to make sure everything, the patients, I have the right patient, the right medication, and everything tallies. So right now I check with the patient's name, Stewart Christie, date of birth. Date of birth is there, is complete. So I check the PIN number. The PIN number is 678945, same, and is complete. Then I have to come and check the medication, the dimethylhydrinate 50 milligram IM every 6 hours as needed. So which is the same. So I'm also gonna check with my drug monograph. So I'll have a look at the drug monograph to check to be sure that the medication is also I don't exceed the dose I'm supposed to take there. So what I have there is 50 milligram, and I think the maximum dose we have here is 600 milligrams. So we are in order. And also, I have to check the printed time. I have to check the time to be sure that this medication has not been administered by any nurse, which is here. So it's not been administered by any nurse. It's still in order, so I can still administer the medication. So that is good. So right now I have my supplies here. The supplies I have here. I have my supplies here. I have my gauge, which is 23 gauge, and I have my syringe, which is 3 ml, and I have my blunt fill. So right now I will be administering the dimethylhydrinate. It's intramuscular medication, so I can use 22 to 25 gauge and 3 ml syringe. So I have to check for the allergy of the patient. I check for the allergy. My patient doesn't have no allergy. Okay, my patient has allergy, he has sulfur, so I'm not going to be administering any sulfur to my patient. All right, and again, all I need to do right now, I need to get my supplies, which I already have here. Then I'm going to have to wash my hands very quickly, and I make sure I get my medication. So I already get my medication. Then I have my blunt fill. Then this is Luke block. Then I have to uncap it. I have my dehydrated here, which is already open. Then I go in here and get my so I have to use the screw techniques and put it back and clap it. So right now I'm going to use my gauge, attach it to the gauge. Open it. Make sure I don't have no bubbles in it. I need to get it to 1 ml. I have to make sure I don't have any bubble in it. So that is it. We have 1 ml here. and there's no bubble, which is good. So I have to use the scoop technique as well. Be sure we don't poke our hand. And that's it. So right now, before I started, I think I already explained the reason. If I have not, then the reason why I am doing this medication is because my patient has been vomiting and I need to administer the medication. And the reason I won't give this medication to a patient who has a high blood pressure and who is not on controlled P, who is not uncontrolled medication, who is not having a controlled medication. And also, I won't give to a patient who has a glycoman. This is further going to put the pressure on that veins, and that's going to affect his eye. So this medication has side effect that is going to give the patient dry throat. It will make you have dry mouth, and it's going to make them feel dizzy. So those are the side effect and the contradictory that goes with the medication. So having done that, I'm going to have to check again. I'm going to have to label this medication. Hydronate, name of the patient, steward bed 10, bed 101, steward room 101, dihydrogenate, 500 milligram, 50 milligram, sorry, TMG, then the date, 22, March 2022. March 2022. So time 10:00 hour, which I'm going to be attaching to. I will attach this to the syringe and leave it here. So having done that, I'm going to quickly also cross check. I'm going to quickly double check, do a second check with my medication. Then I'll check again the hydronate. 50 milligram, with this IM, which is IM, I have it there. Then I check with the ampoule again, then hydronate, 50 milligram, IM. So I have everything ready with me. So right now, I'm going to be moving to the patient's room. But now that I'm done with this, I've already checked this. All these ones will go to the they will go into the bin, the bio bin. So I assume all these ones will also go into the bio bin. I'll just leave them for demonstration purpose. Alright. So right now I'm going to Mrs. Steward's room. So having gotten to Mrs. Steward, I'm going to introduce myself to Mrs. Steward. Oh, Mrs. Steward, my name is Austin Jibo. I'm a second year nursing student in your friend, so I'm here to give you your medication, your injection that the doctor ordered for you. So before I start, please can I check your armband? I'm just going to quickly check your armband. So I'll go to the patient and check for the patient's armband. Yeah, okay. I have Mr. Stewart Christie, that's right, okay. So I'm going to speak to Mr. Stewart. Can you tell me your name? Can you confirm your name? He will tell me his name, ask him for his date of birth, he will tell me his date of birth. And I'll ask him, do you have any allergy? Say, yeah, he has sulfur allergy, okay. I don't have sulfur medication for you here. What I have is dehydrate, and the reason why you have that medication is because you have been vomiting. So this is anti-emetic, antihistamine and anti-emetic medication is going to help you, it's going to stop you from vomiting, and it's going to prevent you from further vomiting. So right now, it's an injection that is going to be administered on the vitreous lateral. So I'm going to be giving you that injection on your vitreous lateral. So that injection, when I'm giving you that injection, you might probably feel a pinch on your on it when you're having that injection, but after that minute, you won't feel that pain anymore. But some people do feel some pain later on, but some don't. And again, I will also let you know that I will also let you know this medication is gonna, the side effect that comes with the medication, it makes you feel dizzy sometimes, and when you have this medication, you can't have any alcohol with it. So it makes you feel dizzy, it makes you have dry mouth and all that. And again, having done that, but I'm just going to quickly compare my medication anyway, check before I administer the medication. So I'll check steward, dehydrogenate, 50 milligram, which is 1 ml. So date of birth is there, and I have everything which is correct. So right now I've asked him for allergy, I've asked him for every other thing. So I've done my third check. So I'm going to be administering the medication. And the part where I'm going to be administering the medication is going to be on the vitreous battery. So Mr. Stewart, so I'm just going to, excuse me, I'm just going to, do your injection, and it's going to be on this part of the so by the time I get here, though, I'm going to have to use a sanitizer to wash my hand, to clean my hand again. And I have I'm going to get my I'll get my alcohol wipe. And I'm going to move this is still water on the side, moving towards the side for demonstration purpose. I'm going to move into the side and just wipe this leg. And this is the part, this is exactly the part I'm going to be giving him that injection, just right here, from here to here. This is vitreous laterals, where you have just this space right here. So this is where I'm going to be giving the injection, and this is the side of the injection. So I'll be doing zip track on here, be doing my zip track after I wipe the area with the alcohol, doing the zip track at the site of the injection, then giving the injection. So having done that, then I'm going to also explain to you for the purpose of the demonstration. So I'm going to do the injection on this area. So how do I do it? Then I'm going to wipe this place in a circular motion, from the inside out. See? So we assume this is the vitreous lateralis, and that's going to be the vitreous lateralis. Then I'll do the Z track, and make sure I go for the site of the injection, and that's it. I'm going to be doing 19 degree. I'll go slowly. That's it. Put that on there, patient. Scoping method. And this will go on the sharp container. That will go on the sharp container for demonstration purpose. I'm still gonna leave it here. Okay? It's supposed to go on the shelf container. That's what it's going. So right now, having done that, then I'm gonna quickly come down here. Sign for the medication. Sign for the medication, March 22. 22 03 22. Then 00 hour. Reason for this medication for emission. For emissions, sorry. For emissions. Effect. And I'll put my initial. AI US the same and 2. So that's it. Then I will be doing my progress note later. So I'm gonna also let my patients know that I'll be coming back to check on him in the next half an hour. Between now and the next half an hour, I'll be coming to check on you, Mr. Stewart. So before I leave, I'll leave my patient with Colbert. I'm gonna leave you with Colbert just in case you need anything. Give us a call. So I'll be here between now and half an hour. But in case you need anything before half an hour, give us a call and somebody will be here to see you. So, and I'll be coming back to check if your vomiting has stopped, if you're still feeling nausea. I have to come here to check to make sure all those things has come down. So that's really my purpose of coming for evaluation. All right, thank you so much. I'll see you again.